This is a debate on the benefits and shortfalls of the American healthcare system and the Canadian healthcare system. On the American side, we have Donna and Brittany, and on the Canadian side, we have Hannah and Shannon. Whenever you're ready, guys.
And to start the debate off, we're going to start with President Theodore Roosevelt, who supported health insurance because he believed that no country could be strong if people were sick and poor. The sick get poor and the poor get sick.
Tommy Douglas believed healthcare should be accessible to all citizens because he believed a healthy country is a strong country. He also believed that everyone should have access to a doctor to get healthier because going in a hospital was signing your death sentence back then if you were poor. He wanted a single healthcare system so everyone received the same care.
In the 30s, loss of wages from being sick, missing work, were considered less of a financial loss than the cost of actually going to a doctor or to a hospital because the hospital costs were on the uprise, so being able to have access to Medicare, then you could afford to seek medical attention, and it was care bigger in family budgets than wage loss.
Well, Tommy Douglas created unions for the workers so that they could get medical benefits so that they could afford to see a doctor instead of sitting at home while losing their wages.
Well, just imagine, as early as the late 1800s, early 1900s, there were 6 major companies that came up with accident insurance, like the railway and the steamboat, would cover the costs if you got sick and missed a day of work. It would be considered a paid day off, or they would have compensation.
We Canadians have a national health insurance, also called Medicare. It's designed to ensure that every resident of Canada receives medical care and hospital treatment, the cost of which is paid through general taxes, through compulsory health insurance premiums.
And we had Medicaid, which was designed for the low, very, very poor who could not afford health insurance. And then you had the Social Security Act for people who made too much money to qualify for Medicaid, but didn't make enough money to afford private health insurance.
Medicare developed in 2 stages. The first was the Hospital Insurance and Diagnostic Act of 1957, which gave the Canadian government authority to enter into an agreement with the provinces to establish a comprehensive universal plan covering acute hospital care and laboratory and radiology diagnostic services. 9 years later, the Medicare Act of 1966 extended health insurance to cover doctor services.
Well, with our dental insurance, helps pay for costs of necessary dental care. It only covers 97% of benefits. And typically, dental plans offer comprehensive benefits. Major dental expenses such as crowns and root canals are just partly covered.
Well, in Canada, tooth decay among children was so prevalent that one Toronto dentist estimated that 50% of the school children at the turn of the century had rotten teeth. Today, provincial health insurance plans provide some dental coverage, although some coverage varies from province to province, being generally limited to dental care in hospitals.
Our vision care insurance provides coverage for routine eye care and is typically written to complement other medical benefits. Vision benefits are designed to encourage routine eye examinations and ensure appropriate treatment is provided.
General public insurance covers medical payments for eye injury and various eye diseases such as cataracts, glaucoma, and diabetic retinopathy. Optional supplemental vision insurance provides additional insurance coverage for eye examinations, contact lenses, and eyeglasses, and frames, and in some instances, part of the cost for the elective laser surgery for vision correction.
Now, with our mental health, America is very involved with this. Whether we have a mental illness such as depression, known someone who has experienced such a problem, or neither, we need to care about the issues of mental health. After all, we all have mental health.
The Canadian National Committee for Mental Hygiene was founded in 1918, largely due to the efforts of Dr. Clarence Hincks, who with the help of leading Canadians raised funds for a survey for conditions in asylums across Canada. These institutions were generally disgraceful, dirty, and overcrowded. The committee brought this to be the attention of the public, and the provinces soon began to spread more money on institutions for the mentally ill. By 1950, discoveries of drugs that could help control the behavior of mental patients led to a new turn in care. Many patients from psychiatric hospitals were returned to the communities.
All right. Mental health.
Prior to Medicare, the only treatment available to the less affluent was in provincially owned psychiatric hospitals.
All right. Mental Health America is the country's leading nonprofit dedicated to helping all people live mentally healthier lives, with over more than 320 affiliated nationwide. Our message is simple. Good mental health is fundamental to the health and well-being of every person and of the nation as a whole. Are we done?
General public health insurance covers medical payments for eye injury. I already have that.
I think we're done.
Okay, results, I have a conclusion because Canadians are very prepared. Results from the Joint Canada-United States Survey of Health in 2002 concluded that residents in the two countries have similar health status and access to care, although there are higher levels of inequality in the United States. Although Canada and United States share an open border and are similar in many ways, their healthcare financing systems differ substantially, which impacts rates of healthcare utilization, which I believe leads to Canada winning this.
Well, we want to make sure that our seniors and our children are covered. Public programs provide the primary source of coverage for most seniors, for low-income children and families who meet certain eligibility requirements. So, Medicaid will be awarded to them, I guess. Nobody would ever not be left out.
Nobody is ever left out in Canada as well. Doctors are not allowed to refuse care to patients, no matter if they're wealthy or if they're poor or if they're not even from this country.
And every patient has access to Medicare.
We even provide Medicare cards to people who have come here as an immigration, so that they can even receive the proper medical care. Do you?
So in conclusion, this has been our debate.